Weight regain after stopping obesity drugs. What you need to know. Have you ever wondered what happens to your body after you stop taking weight loss medications? A recent meta-analysis published in BMC Medicine reveals a concerning trend. Patients who have been prescribed obesity drugs often find themselves regaining weight once they discontinue their treatment. This study, which meticulously examined data from 11 randomized trials, indicates that while the extent of weight regain can differ based on the specific medication used, a general pattern of weight rebound is evident after the treatment ends. In the United States, 6 anti-obesity medications, AOMs, have received approval from the FDA to aid individuals in their weight loss journeys. These include well-known options like orlistat, phentermine-topiramate, and semaglutide. Interestingly, glucagon-like peptide 1, GLP, originally developed for diabetes management, has also gained popularity as a weight loss aid. However, emerging research suggests that patients who stop taking these AOMs may experience significant weight regain in the months following the cessation of their medication. The meta-analysis conducted by Xiaoling Kai, Lining Ji, and their team reviewed 11 studies from various parts of the globe, focusing on weight changes in patients after they stopped using AOMs. In total, the analysis included data from 1,574 participants in treatment groups and 893 in control groups. The researchers measured weight changes by assessing variations in body weight and BMI after the patients ceased their medication. Among the studies analyzed, 6 concentrated on GLP-1 receptor agonists. One examined both GLP-1 and GLP dual receptor agonists. Another focused on orlistat, 2 on phentermine-topiramate, and 1 on naltrexone-bupropion. To ensure a comprehensive understanding, the authors accounted for various factors that could influence weight changes, such as the type of medication, the presence of diabetes, and whether participants made lifestyle changes like altering their diet or increasing physical activity. Their findings revealed that while AOMs were effective in promoting weight loss during treatment, patients began to regain weight approximately 8 weeks after stopping the medication. This weight regain continued for an average of 20 weeks before stabilizing. Notably, the amount of weight regained varied significantly, with participants experiencing notable increases at 8, 12, and 20 weeks post-treatment. Factors influencing the extent of weight regain included the specific medication used and the consistency of lifestyle changes adopted by the participants. For instance, those who completed a 36-week regimen of tirzepatide, a commercially available GLP-1 receptor agonist, regained nearly half of the weight they had lost once they switched to a placebo. It's important to note that this meta-analysis did not encompass studies involving lifestyle interventions or bariatric surgery, which limits the ability to compare different weight loss strategies within the study's framework. Additionally, the phenomenon of weight regain is not exclusive to AOMs. It has also been documented in other weight loss methods, such as gastric bypass and vertical banded gastroplasty. This raises an important question. What can be done to maintain weight loss after stopping medication? Are there effective strategies that can help individuals sustain their weight loss in the long term? We invite you to share your thoughts and experiences in the comments below. Let's discuss the complexities of weight management and explore potential solutions together. Weight loss jabs. Why the pounds come back after stopping treatment. A warning to those considering weight loss jabs. It's a temporary fix with potential long-term consequences. While these drugs offer a promising solution for those struggling with obesity, the results are not permanent. The issue lies in the nature of these medications. They effectively suppress hunger signals, aiding in weight loss. However, once the treatment concludes, those signals can reemerge, leading to a rebound in weight gain. Research highlights this phenomenon. A review of over 2,000 individuals found that while they maintained their weight loss for a short period post-treatment, the pounds started creeping back by the 8-week mark. This weight gain often continued for 5 months before stabilizing. But here's where it gets controversial. Patients who took the popular fat jab, Mounjaro, regained almost half of the weight they had lost during treatment. This suggests that while these jabs can be effective in the short term, they may not provide a sustainable solution for long-term weight management. Dr. Shaolin Kai, the study's author from Peking University People's Hospital, emphasizes the need for long-term anti-obesity treatments. Catherine Jenner, director of Britain's Obesity Health Alliance, adds, "This underlines why we can't medicate ourselves out of the obesity crisis. Without addressing the root causes, people are left fighting an uphill battle." A separate study from Oxford University suggests that many patients regain all the weight they lose within 2 years of stopping medication. This highlights the importance of sustainable lifestyle changes alongside any medical intervention. With NHS prescriptions for jabs like Wegovy and Mounjaro reaching 2.7 million in England last year, and more people opting for private purchases, there's a risk of missing out on crucial diet and lifestyle advice. So, while fat jabs may offer a quick fix, they're not a magic solution. It's crucial to approach weight loss with a holistic mindset, addressing both the physical and the underlying causes. What are your thoughts on this? Do you think these jabs are a viable option, or do we need to focus more on long-term lifestyle changes? Let's discuss in the comments. Ozempic and Wegovy. What happens when you stop taking weight loss drugs? The shocking truth: weight regain begins just weeks after stopping popular weight loss medications. Individuals using popular weight loss medications, such as Ozempic and Wegovy, might experience weight rebound within mere weeks after stopping treatment, according to alarming new research. A comprehensive analysis published Tuesday in BMC Medicine examined data from 11 clinical trials encompassing approximately 2,500 participants, revealing a disturbing pattern. Patients consistently regained their lost weight once they discontinued medication therapy. Currently, healthcare providers can prescribe 6 FDA-approved medications for adult obesity management: orlistat, naltrexone bupropion, semaglutide, liraglutide, tirzepatide, and phentermine-topiramate. Notably, 6 of the 11 trials analyzed specifically investigated semaglutide, the active component in both Ozempic and Wegovy. While mounting evidence demonstrates that extended use of these anti-obesity medications can produce remarkable weight reduction in adults, early studies suggest this progress reverses after discontinuation. The review authors highlight a critical knowledge gap, stating, "The long-term weight changes following discontinuation of anti-obesity medications, AOMs, have not been systematically evaluated until now." Originally prescribed to patients struggling with obesity and type 2 diabetes, semaglutide has increasingly been marketed off-label as a rapid weight loss solution. But here's where it gets concerning. Researchers from Peking University People's Hospital in China discovered that while these medications effectively promote significant weight loss during active treatment, patients may begin experiencing weight rebound as early as 8 weeks after stopping, a much faster reversal than many patients might expect. The research team analyzed information from 1,574 participants receiving treatment and 893 in control groups across the 11 clinical trials. They monitored weight fluctuations by tracking body weight measurements and BMI calculations after medication cessation. To ensure accuracy, researchers accounted for variables including medication type, diabetes status, and lifestyle modifications, such as dietary changes or exercise regimens. Their findings revealed that weight regain continued for approximately 20 weeks post-discontinuation before eventually stabilizing. Significant weight regain occurred 8 weeks after discontinuation of AOMs and persisted through 20 weeks, the researchers reported. The analysis identified distinct periods of substantial weight rebound at 8, 12, and 20 weeks after treatment cessation. Interestingly, the extent of weight rebound appeared influenced by several factors, including the specific medication used and consistency of lifestyle changes. For example, patients who completed a 36-week treatment course with tirzepatide, another weight loss medication, regained nearly half their lost weight after switching to a placebo, a fact that many healthcare providers may not adequately communicate to patients. And this is the part most people miss. These medications may require indefinite use to maintain results, raising questions about long-term health impacts and financial sustainability for patients. The researchers emphasize the need for additional studies with extended follow-up periods to better understand the factors associated with post-treatment weight changes. Do you believe these medications should be prescribed with clearer warnings about weight regain? Or should healthcare focus shift towards sustainable lifestyle changes instead of medication-dependent solutions? Share your thoughts on this controversial approach to weight management in the comments.